161. A nurse is caring for a patient with a chest tube after a pneumothorax. Which of the following should the nurse prioritize when monitoring the chest tube system? A. Checking for air bubbles in the water seal chamber. B. Ensuring the chest tube is clamped when not in use. C. Keeping the chest tube drainage system above the level of the chest. D. Ensuring that the chest tube is securely taped at the insertion site. Answer. A. Checking for air bubbles in the water seal chamber. Rationale. Air bubbles in the water seal chamber indicate a potential air leak in the system, which needs to be addressed promptly to prevent complications. 162. A nurse is caring for a patient who is receiving a blood transfusion. Which action is most important to take during the first 15 minutes of the transfusion? A. Monitor vital signs and observe for reactions. B. Administer pain medications if the patient complains of discomfort. C. Allow the patient to drink fluids freely. D. Restrict the patient's activity during the transfusion. Answer. A. Monitor vital signs and observe for reactions. Rationale. The first 15 minutes of a blood transfusion are critical for identifying potential allergic or transfusion reactions, so monitoring vital signs is essential. 163. A nurse is assessing a patient for possible sepsis. Which of the following signs and symptoms should the nurse prioritize for immediate intervention? A. Decreased blood pressure and increased heart rate. B. Warm, flushed skin and normal temperature. C. Dry mouth and decreased urinary output. D. Decreased respiratory rate and clear lung sounds. Answer. A. Decreased blood pressure and increased heart rate. Rationale. Decreased blood pressure and increased heart rate are key signs of sepsis, indicating a need for immediate intervention to prevent shock. 164. A nurse is caring for a patient with a history of hypertension. Which blood pressure reading would indicate the need for further assessment and intervention? A. 130/85 mmHg. B. 140/90 mmHg. C. 160/100 mmHg. D. 120/75 mmHg. Answer. C. 160/100 mmHg. Rationale. A blood pressure of 160/100 mmHg is considered hypertensive and requires further assessment and possible intervention to prevent complications. 165. A nurse is caring for a postoperative patient who is complaining of nausea and vomiting. Which intervention should the nurse implement first? A. Administer an antiemetic as prescribed. B. Encourage the patient to drink fluids. C. Increase the frequency of ambulation. D. Perform an assessment of bowel sounds. Answer. A. Administer an antiemetic as prescribed. Rationale. Administering an antiemetic will address the patient's symptoms of nausea and vomiting and provide relief. 166. A nurse is caring for a patient with a history of diabetes mellitus who is experiencing hypoglycemia. Which of the following interventions should be prioritized? A. Administer a 15g carbohydrate snack. B. Administer insulin to lower the blood glucose level. C. Encourage the patient to rest and drink fluids. D. Monitor the patient's blood glucose every 30 minutes. Answer. A. Administer a 15g carbohydrate snack. Rationale. In hypoglycemia, providing a quick source of glucose, 15g carbohydrate snack, is essential for raising the patient's blood sugar level to normal levels. 167. A nurse is caring for a patient who has a history of falls. Which intervention is most effective in preventing future falls? A. Ensure that the call light is within reach at all times. B. Use a gait belt when assisting the patient to ambulate. C. Encourage the patient to wear non-slip socks while in bed. D. Keep the room lights dimmed to prevent confusion at night. Answer. B. Use a gait belt when assisting the patient to ambulate. Rationale. Using a gait belt ensures safe ambulation by providing support and reducing the risk of falls when the patient is moving. 168. A nurse is caring for a patient with a severe allergic reaction to a bee sting. Which of the following interventions should the nurse perform first? A. Administer epinephrine as prescribed. B. Apply a cold compress to the affected area. C. Assess the patient's airway and respiratory status. D. Monitor vital signs every 15 minutes. Answer: C. Assess the patient's airway and respiratory status. Rationale: the most urgent concern in an allergic reaction is airway compromise, and the nurse must assess the airway first to ensure proper oxygenation. 169. A nurse is caring for a patient who has just received a dose of digoxin. Which of the following findings would indicate that the nurse should withhold the medication? A. A pulse rate of 58 beats per minute. B. A blood pressure of 120/78 mmHg. C. Serum potassium level of 3.0 milliequivalent/L. D. Serum creatinine level of 1.2 milligrams per deciliter. Answer: A. A pulse rate of 58 beats per minute. Rationale: digoxin slows the heart rate, and a pulse rate below 60 beats per minute is a sign that the medication should be withheld due to the risk of bradycardia. 170. A nurse is caring for a patient who is receiving intravenous fluids. The nurse notices that the foresite is swollen and cool to the touch. What is the first action the nurse should take? A. Remove the forecatheter and apply a warm compress. B. Increase the flow rate of the fluids. C. Document the findings and continue to monitor. D. Notify the healthcare provider immediately. Answer: A. Remove the forecatheter and apply a warm compress. Rationale: the swelling and coolness at the foresite indicate possible infiltration, and the first step is to remove the forecatheter and apply a warm compress to reduce discomfort and swelling. 171. A nurse is caring for a patient who is at risk for developing pressure ulcers. Which of the following is the most important intervention to prevent pressure ulcers? A. Turn the patient every 2 hours. B. Massage bony prominences to improve circulation. C. Provide a high-protein diet to promote healing. D. Keep the patient's skin clean and dry. Answer: A. Turn the patient every 2 hours. Rationale: repositioning the patient every 2 hours helps reduce pressure on bony prominences and is a primary method for preventing pressure ulcers. 172. A nurse is caring for a patient with end-stage renal disease, ESRD. Which of the following interventions is most important to prevent complications? A. Encourage high-protein intake. B. Monitor electrolyte levels, particularly potassium. C. Limit fluid intake to 2 liters per day. D. Increase sodium intake to prevent dehydration. Answer: B. Monitor electrolyte levels, particularly potassium. Rationale: in ESRD, the kidneys cannot adequately excrete potassium, which can lead to dangerous hyperkalemia. Monitoring potassium levels is crucial. 173. A nurse is caring for a patient with acute pancreatitis. Which of the following interventions is most important in the management of this condition? A. Encourage oral fluid intake. B. Administer analgesics for pain relief. C. Encourage a high-fat diet for nutrition. D. Monitor blood glucose levels closely. Answer: B. Administer analgesics for pain relief. Rationale: pain management is the priority in acute pancreatitis as it is often associated with severe pain, and adequate pain relief is essential for patient comfort and recovery. 174. A nurse is educating a patient with chronic obstructive pulmonary disease, COPD, about medication use. Which statement by the patient indicates the need for further teaching? A. I should use my inhaler before exercising to prevent shortness of breath. B. I should wait 30 seconds between inhalations if using 2 inhalers. C. I can stop using my inhaler once my symptoms improve. D. I should rinse my mouth after using my inhaler to prevent oral infections. Answer: C. I can stop using my inhaler once my symptoms improve. Rationale: COPD is a chronic condition, and the patient should continue to use the prescribed medications as directed, even if symptoms improve, to manage the disease effectively. 175. A nurse is caring for a patient who is receiving a transfusion of packed red blood cells. The nurse notices that the patient has developed a fever and chills. What is the first action the nurse should take? A. Stop the transfusion immediately and notify the healthcare provider. B. Continue the transfusion and monitor the patient closely. C. Administer an antipyretic medication as prescribed. D. Increase the rate of the transfusion to counteract the symptoms. Answer: A. Stop the transfusion immediately and notify the healthcare provider. Rationale: a fever and chills during a blood transfusion are signs of a potential transfusion reaction, and stopping the transfusion is the first action to prevent further complications. 176. A nurse is caring for a patient with a diagnosis of acute renal failure. Which intervention should the nurse prioritize? A. Administering a diuretic to promote fluid loss. B. Monitoring serum creatinine and BUN levels. C. Encouraging the patient to drink increased fluids. D. Restricting potassium intake to prevent hyperkalemia. Answer: B. Monitoring serum creatinine and BUN levels. Rationale: monitoring renal function markers like creatinine and BUN is critical in managing acute renal failure and guiding treatment decisions. 177. A nurse is caring for a patient who is receiving oxygen therapy via nasal cannula. The nurse notes that the patient's oxygen saturation is 88%. Which of the following actions should the nurse take first? A. Increase the oxygen flow rate. B. Reposition the nasal cannula. C. Notify the healthcare provider. D. Assess the patient's respiratory status. Answer: D. Assess the patient's respiratory status. Rationale: the first action is to assess the patient's respiratory status to determine the cause of the low oxygen saturation and take appropriate action. 178. A nurse is caring for a patient with a surgical wound that has signs of infection, including redness, warmth, and purulent drainage. Which of the following interventions is most important? A. Monitor the wound for any changes in size. B. Cleanse the wound with sterile saline and apply a new dressing. C. Administer a tetanus booster as prescribed. D. Perform a complete blood count (CBC) to assess for systemic infection. Answer: B. Cleanse the wound with sterile saline and apply a new dressing. Rationale: the most important intervention is to cleanse the wound to prevent further infection and apply a clean dressing to promote healing. 179. A nurse is caring for a patient who is receiving chemotherapy and has developed neutropenia. Which action should the nurse prioritize? A. Monitor the patient's temperature every 4 hours. B. Administer prescribed colony-stimulating factor, CSF. C. Encourage the patient to maintain a high-protein diet. D. Restrict visitors to prevent infections. Answer: A. Monitor the patient's temperature every 4 hours. Rationale: neutropenic patients are at high risk for infection, so frequent temperature monitoring is crucial for identifying early signs of infection. 180. A nurse is assessing a patient who has just been prescribed a new antihypertensive medication. Which of the following should the nurse include in the teaching plan? A. Monitor your blood pressure regularly while taking this medication. B. This medication should only be taken in the morning. C. This medication can be stopped immediately if side effects occur. D. It is important to take this medication with food to prevent nausea. Answer: A. Monitor your blood pressure regularly while taking this medication. Rationale: monitoring blood pressure regularly is essential to assess the effectiveness of antihypertensive medication and adjust the dose as needed. 181. A nurse is caring for a patient who is at risk for deep vein thrombosis, DVT. Which intervention should the nurse prioritize? A. Encourage the patient to walk frequently. B. Massage the patient's legs to promote circulation. C. Place a heating pad on the patient's legs to relieve discomfort. D. Ensure that the patient remains in bed as much as possible. Answer: A. Encourage the patient to walk frequently. Rationale: encouraging ambulation helps prevent the formation of DVT by promoting circulation and reducing the risk of blood clots. 182. A nurse is caring for a patient who has just received a dose of 4-morphine for pain management. Which of the following is the nurse's priority action? A. Monitor the patient's oxygen saturation and respiratory rate. B. Encourage the patient to cough and deep breathe. C. Increase the patient's fluid intake to prevent constipation. D. Document the patient's pain level every 4 hours. Answer: A. Monitor the patient's oxygen saturation and respiratory rate. Rationale: morphine can cause respiratory depression, and the nurse must prioritize monitoring the patient's oxygen saturation and respiratory rate for early signs of respiratory compromise. 183. A nurse is caring for a patient who has just had a hysterectomy. Which of the following interventions should the nurse prioritize to prevent postoperative complications? A. Encourage deep breathing and coughing exercises. B. Administer analgesics as prescribed. C. Ensure the patient's diet includes high-fiber foods. D. Assist the patient with leg exercises every hour. Answer: A. Encourage deep breathing and coughing exercises. Rationale: deep breathing and coughing exercises help prevent atelectasis and pneumonia, which are common postoperative complications. 184. A nurse is caring for a patient with a history of alcohol abuse who is experiencing withdrawal symptoms. Which of the following findings should the nurse prioritize? A. Tremors and restlessness. B. Diaphoresis and nausea. C. Hypertension and tachycardia. D. Delirium and hallucinations. Answer: D. Delirium and hallucinations. Rationale: delirium and hallucinations are severe symptoms of alcohol withdrawal and indicate the need for immediate intervention to prevent further complications. 185. A nurse is caring for a patient with a history of asthma who is experiencing an acute exacerbation. Which of the following interventions should the nurse prioritize? A. Administer a short-acting beta-agonist (SABA) inhaler. B. Administer a corticosteroid inhaler. C. Encourage the patient to perform pursed lip breathing. D. Increase the oxygen flow rate to 4 liters per minute. Answer: A. Administer a short-acting beta-agonist (SABA) inhaler. Rationale: a short-acting beta-agonist (SABA) inhaler is the first-line treatment for acute asthma exacerbations to relieve bronchospasm and improve airflow. 186. A nurse is caring for a patient who has just been admitted for acute respiratory distress syndrome, ARDS. Which of the following actions should the nurse prioritize? A. Administer prescribed diuretics. B. Position the patient in a high Fowler's position. C. Provide supplemental oxygen as prescribed. D. Monitor blood gas levels every hour. Answer: C. Provide supplemental oxygen as prescribed. Rationale: oxygen therapy is crucial in managing ARDS to maintain adequate oxygenation and prevent further hypoxemia. 187. A nurse is caring for a patient with a central venous catheter, CVC, who has developed a fever and chills. Which of the following actions should the nurse take first? A. Draw blood cultures from the CVC and peripheral site. B. Increase the flow rate of 4 fluids to maintain hydration. C. Administer prescribed antipyretics to reduce fever. D. Remove the CVC immediately and notify the healthcare provider. Answer: A. Draw blood cultures from the CVC and peripheral site. Rationale: the nurse should draw blood cultures to identify any possible infection associated with the CVC before taking further actions. 188. A nurse is caring for a patient who has been prescribed warfarin. Which of the following lab values should the nurse monitor closely? A. Hemoglobin and hematocrit levels. B. Prothrombin time, PT, and international normalized ratio, INR. C. Blood urea nitrogen, BUN, and creatinine levels. D. Serum albumin and total protein levels. Answer: B. Prothrombin time, PT, and international normalized ratio, INR. Rationale: warfarin is an anticoagulant, and monitoring PT and INR is essential to ensure the patient's blood is appropriately thin to prevent clotting. 189. A nurse is caring for a patient who has undergone a total knee replacement. Which of the following interventions should the nurse prioritize to prevent complications? A. Encourage the patient to perform leg exercises. B. Apply ice to the knee joint for 20 minutes every hour. C. Encourage the patient to use a continuous passive motion (CPM) machine. D. Assist the patient in turning and repositioning every 2 hours. Answer: A. Encourage the patient to perform leg exercises. Rationale: leg exercises are essential to prevent complications such as deep vein thrombosis, DVT, and improve circulation after a total knee replacement. 190. A nurse is caring for a patient with a suspected myocardial infarction, MI. Which of the following actions should the nurse take first? A. Administer oxygen as prescribed. B. Prepare for possible thrombolytic therapy. C. Obtain a 12-lead electrocardiogram, ECG. D. Assess the patient's pain level. Answer: A. Administer oxygen as prescribed. Rationale: oxygen is the first intervention to ensure adequate oxygenation and prevent further myocardial damage during a suspected MI. 191. A nurse is caring for a patient who has been prescribed an antipsychotic medication. Which of the following side effects should the nurse monitor for closely? A. Drowsiness and lethargy. B. Increased appetite and weight gain. C. Tremors and rigidity. D. Dry mouth and constipation. Answer: C. Tremors and rigidity. Rationale: antipsychotic medications can cause extrapyramidal side effects such as tremors and rigidity, which should be monitored closely. 192. A nurse is caring for a patient who has developed a pressure ulcer. Which of the following is the most important factor in promoting wound healing? A. Applying a dry dressing to the wound daily. B. Ensuring proper nutrition with adequate protein intake. C. Using an antimicrobial ointment to prevent infection. D. Keeping the wound covered with a transparent dressing. Answer: B. Ensuring proper nutrition with adequate protein intake. Rationale: adequate nutrition, especially protein, is essential for wound healing by promoting tissue repair and cell regeneration. 193. A nurse is caring for a patient who has been diagnosed with hyperthyroidism. Which of the following symptoms should the nurse monitor for closely? A. Bradycardia and weight gain. B. Increased appetite and weight loss. C. Cold intolerance and constipation. D. Decreased blood pressure and lethargy. Answer: B. Increased appetite and weight loss. Rationale: hyperthyroidism typically causes symptoms such as increased appetite, weight loss, and tachycardia due to an overactive thyroid. 194. A nurse is caring for a patient with pneumonia. Which of the following interventions should the nurse prioritize to improve oxygenation? A. Administer prescribed antibiotics. B. Provide supplemental oxygen as prescribed. C. Encourage the patient to drink plenty of fluids. D. Perform chest physiotherapy as prescribed. Answer: B. Provide supplemental oxygen as prescribed. Rationale: oxygen therapy is crucial to improve oxygenation and prevent hypoxemia in patients with pneumonia. 195. A nurse is caring for a patient who is receiving 4-potassium. The nurse notices that the 4 site is red and swollen. What is the nurse's priority action? A. Stop the infusion and remove the 4. B. Increase the flow rate of the 4. C. Apply warm compresses to the 4 site. D. Document the findings and continue the infusion. Answer: A. Stop the infusion and remove the 4. Rationale: redness and swelling at the 4 site can indicate infiltration or phlebitis, so the first action is to stop the infusion and remove the 4 to prevent further complications. 196. A nurse is teaching a patient about managing hypertension with lifestyle changes. Which of the following should the nurse include in the teaching plan? A. You should avoid all sources of caffeine. B. Limit alcohol intake to no more than 2 drinks per day. C. Engage in high-intensity exercise for at least 30 minutes daily. D. Increase your sodium intake to ensure proper fluid balance. Answer: B. Limit alcohol intake to no more than 2 drinks per day. Rationale: limiting alcohol intake is recommended for managing hypertension. Excess alcohol can increase blood pressure. 197. A nurse is caring for a patient who is scheduled for a colonoscopy. Which of the following should the nurse instruct the patient to avoid before the procedure? A. Drinking clear liquids. B. Taking prescribed medications. C. Eating solid food. D. Using an enema. Answer: C. Eating solid food. Rationale: patients should avoid solid food before a colonoscopy to ensure the colon is clear for the procedure. 198. A nurse is caring for a patient with diabetes mellitus who is experiencing hypoglycemia. Which of the following actions should the nurse take first? A. Administer an oral glucose tablet. B. Call for assistance from the healthcare provider. C. Administer insulin as prescribed. D. Encourage the patient to drink water. Answer: A. Administer an oral glucose tablet. Rationale: the first action for hypoglycemia is to administer a fast-acting carbohydrate, such as an oral glucose tablet, to quickly raise the patient's blood sugar. 199. A nurse is caring for a patient who has just undergone a total hip replacement. Which of the following interventions should the nurse prioritize to prevent complications? A. Maintain the patient in a supine position. B. Apply a continuous passive motion (CPM) machine to the affected hip. C. Encourage the patient to perform leg exercises. D. Restrict the patient's fluid intake to prevent swelling. Answer: C. Encourage the patient to perform leg exercises. Rationale: leg exercises help prevent complications such as deep vein thrombosis, DVT, and promote circulation following surgery. 200. A nurse is caring for a patient who is receiving an opioid analgesic for pain management. Which of the following is the nurse's priority assessment? A. Heart rate and rhythm. B. Respiratory rate and oxygen saturation. C. Bowel sounds and abdominal distension. D. Skin temperature and color. Answer: B. Respiratory rate and oxygen saturation. Rationale: opioid analgesics can cause respiratory depression, so it is important to monitor the respiratory rate and oxygen saturation to ensure the patient is breathing effectively.